A handful of Canadian doctors say they've found a cure to a debilitating, even deadly disease. Their solution for fighting C. difficile seems simple: a handful of something else, feces. And there's the problem. As the National's health reporter Maureen Taylor found out, hospitals across the country are refusing to allow fecal transplants, even though they could save lives.
This is the container that I collected my stool sample in.
Why would Wendy Sinyukov put her stool in an ice cream container and take it on an airplane?
And I had to keep it in the fridge. And I had to forewarn my children, who are always hungry, not to go searching in the fridge for things to eat.
Sinyukov did it for her sister, Marcia Monroe. 2 years ago, Monroe was suffering from recurrent bouts of C. difficile, a superbug that can cause severe, painful diarrhea that may last months.
I had wasted away to next to nothing as far as my weight goes. I was wearing pull-ups for about a year.
Monroe was caught up in a wave of C. difficile outbreaks that first hit Canadian hospitals in 2003. In Quebec, at least 2,000 deaths were linked to C. difficile in a 2-year period.
Can I get you to lean forward?
Dr. Mike Silverman says C. diff infections can happen when people are put on antibiotics. The drugs kill off the good bacteria along with the bad.
The normal bacteria that are in our bowels inhibit the growth of C. difficile. If you wipe out the normal bacteria by taking antibiotics, then this bug overgrows.
Dorothy Badry suffered with C. diff for almost a year.
You're literally tied to the bathroom all the time. You're going to the bathroom probably at least 40 times a day.
Eventually, both Badry and Monroe were referred to Dr. Tom Louie. He's one of the few Canadian doctors treating severe recurrent C. difficile with fecal transplantation. He's now treated 38 people.
These people have had their lives being put on hold for anywhere between 6 months and 2 years.
A fecal transplant involves collecting stool from a healthy donor, ideally a close relative, and liquefying it. Then it's given to the patient in an enema. Although the procedure hasn't been studied in a large clinical trial, those who've tried fecal transplants say they can cure more than 90% of patients.
This therapy is my backup plan that I'll guarantee you that I'll make you better. I will guarantee you, and I've actually delivered on that. They've all gotten better.
Feces are the ultimate probiotic. By introducing healthy feces through a transplant, the patient's bowel lining is repopulated with beneficial bacteria, and the C. difficile is pushed out. Dr. Silverman has now done 4 fecal transplants.
When it's have your large bowel removed or have some feces in an enema, most people would prefer feces in an enema.
If it works, I say go for it.
I was cured.
So why are fecal transplants only being offered in 3 Canadian centres? Even Dr. Louie has to do the transplants outside the hospital.
At the Calgary General, they said it's un-Canadian and you must leave the hospital. You cannot do it here.
It's not exactly the thing people line up and go, it's my turn, I get to do that.
Marcia and Wendy laugh now when they remember taking the stool sample through airport security.
I was terrified that they were going to open it, and
everyone hopes that better drugs will come along to treat C. difficile. In the meantime, Dr. Louie would like his Canadian colleagues across the country to get over the ick factor and offer fecal transplants to their sickest patients. Maureen Taylor, CBC News, Toronto.